Welcome to this video where we will explore the concepts of sensitivity and specificity, their calculations, and two related measurements known as positive and negative predictive values. Medical tests play a crucial role in determining the presence or absence of a disease. However, tests are not infallible, which is where sensitivity and specificity come into play. These measures help assess the accuracy of a test in correctly identifying the presence or absence of a disease. Let's delve deeper into these concepts. To understand these terms, let's consider a table that presents the outcomes of the test and the disease status. In any population, there are individuals with the disease and those without it. When a test is performed, the result can be either positive or negative. A positive test should indicate the presence of the disease, referred to as a true positive. It correctly identifies individuals who have the disease. Conversely, a negative test should imply the absence of the disease, termed a true negative. It correctly identifies individuals without the disease. However, due to the imperfections of tests, false results can occur. A false positive refers to a positive test in an individual without the disease. This can lead to unnecessary follow-up tests, treatments, psychological distress, and associated costs or risks. On the other hand, a false negative occurs when a test incorrectly identifies an individual without the disease. This can result in delayed diagnosis, delayed treatment, negative health outcomes, a false sense of security, continuation of risky behaviors, and even legal consequences. Sensitivity and specificity can be calculated using these terms. Sensitivity is the proportion of individuals with the disease who test positive for it. A high sensitivity indicates a higher proportion of true positives and a lower proportion of false negatives. Conversely, specificity is the proportion of individuals without the disease who test negative for it. A high specificity signifies a higher proportion of true negatives and a lower proportion of false positives. Let's illustrate this with an example. Suppose we have a group of 600 people, with 100 individuals having the disease and 500 without it. If we conduct a test on those with the disease, ideally, we would obtain 100 positive results. However, let's assume that only 90 individuals test positive, resulting in 90 true positive cases. This leaves us with 10 false negatives, individuals with the disease but a negative test result. In this example, the sensitivity of the test would be 0.9 or 90%. Now, let's perform the test on the 500 individuals without the disease. Ideally, we would obtain 500 negative results. However, assuming the test yields 400 negative results, we have 400 true negatives. This implies that 100 individuals without the disease receive a positive test result, leading to 100 false positives. In this scenario, the specificity of the test would be 0.8 or 80%. Tests with high sensitivity are suitable for screening purposes since they have a lower proportion of false negatives. Conversely, tests with high specificity are appropriate for confirmatory tests as they have a lower proportion of false positives. In an ideal situation, a perfect test would exhibit 100% sensitivity and specificity. The closer a test's sensitivity and specificity are to 100%, the more reliable it is in confirming or excluding the disease. Lastly, let's briefly discuss positive and negative predictive values, which provide insights from a testing perspective. In our previous example, we had 190 individuals testing positive and 410 testing negative. The positive predictive value represents the proportion of individuals with a positive test who truly have the disease. In this example, the positive predictive value would be 47.4%. The negative predictive value indicates the proportion of individuals with a negative test who do not have the disease. Here, the negative predictive value is 97.6%. Positive and negative predictive values depend on the prevalence of the disease in the population. In general, as disease prevalence increases, the positive predictive value also increases, while the negative predictive value decreases. In summary, sensitivity and specificity provide valuable information about the accuracy of a medical test in identifying the presence or absence of a disease. They guide healthcare professionals in determining the appropriateness of a test and interpreting its results. Additionally, positive and negative predictive values offer insights from a testing standpoint, considering the proportion of true positives and true negatives in relation to the test outcome. Understanding these concepts helps in evaluating the reliability of tests and making informed decisions in healthcare settings.